Things you should know about the child health card. At birth, a healthy baby's weight is usually expected to fall between 2.5 and 4.0 kilograms. If a baby is born weighing less than 2.5 kilograms, that baby is considered underweight, and we call this low birth weight. If a baby is born weighing more than 4.0 kilograms, that baby is considered to be above the normal range, and this is sometimes called macrocosmic baby, and such baby is usually at increased risk for some health risks. This is the most reason the curves originated from 2.5 and 4 kilograms, respectively. It is important you know also that from birth onwards, a child's growth is carefully tracked using a growth monitoring chart, also known as the Road to Health chart. Now, let's talk about the lines on the card. On the x-axis, which is also the horizontal line, we have the child's age written in months. It starts from birth, then goes to 12 months, continue to 24 months, 36 months, 48 months, and up to 60 months, which is 5 years. On the y-axis, which is also the vertical line, we have the child's weight in kilograms. Now the curves. The chart has two main curve lines, an upper line and a lower line. A child's weight is expected to fall between these two lines. If the baby's weight goes below the lower line, it is a sign the child is not growing well or may be malnourished. Therefore, medical attention is needed. If the baby's weight goes above the upper line, it suggests the child may be overweight, therefore needs urgent attention. If you have noticed, there are separate growth curves for boys and girls. For girls, the expected weight curve is slightly lower compared to that of the boy's curve. If a girl's weight falls below her line, it means something is not right, and therefore, intervention is highly required. For boys, the curve is slightly higher, since boys generally weigh a little more than girls of the same age. The main point here is, every child is expected to grow within the two curved lines on the chart. This is called Road to Health chart. For boys, their weight should stay between the upper and lower continuous lines. For girls, their weight should stay between the upper and lower dotted lines. If a child's weight goes above the upper line, it requires attention. This may mean the child is developing overweight or obesity. Remember, malnutrition does not only mean lack of food, it can also mean eating too much of the wrong types of food. If a child's weight goes below the lower line, this is also malnutrition. We call it undernutrition, and the possible causes include baby not being fed well, baby not being breastfed, baby having poor complementary feeding pattern, or baby had illnesses such as diarrhea or other infections that may have prevented proper weight gain. The growth chart therefore acts as an alert system for parents and health workers. When we plot the child's weight month by month, we can see whether the child is following the expected growth path. If the weight drops suddenly or rises too high outside the band, it signals the need to ask questions. Is the baby healthy? Is the baby feeding appropriate? Is there sickness or poor care at home? This is how the chart guides us to monitor growth. In summary, the Road to Health chart is a powerful tool. Any child who grows within the band between the two curves is healthy. But once the child falls outside the band, above or below, it is a warning sign of malnutrition, requiring urgent attention and intervention.